Welcome back. In this session, we are going to discuss about COCCULUS. You can see in the picture here, COCCULUS drug. Starting with the common name. COCCULUS is also known as Cocculus indicus or Indian cockle. This drug, which is belonging to the vegetable kingdom, was proved by Dr. Hahnemann, and it belongs to the family Menispermaceae. So let us have some background about COCCULUS. This is a poisonous vegetable plant. Hahnemann says that this vegetable substance, used therefore only for destroying some noxious agents, for stupefying fishes so that they may be caught by hand, was first employed by the medicine myself. So what did Hahnemann say? This COCCULUS was used for stupefying the fishes. Okay, they used to stupefy the fish and so that it can get caught easily by hand. It is the picrotoxin alkaloid, the content of the COCCULUS, which is possessing this toxic effects. When we give it in a crude form, they have a picrotoxin alkaloid. Followed by, this have been served as a homeopathic purpose when it has been administered only in dynamic forms. In the crude form, it is toxic, but when we employ the same substance after the dynamic process of potentization, then what happens? We can employ it in various conditions like brain affections, cholera, colic, convulsions. Then we have fevers, menstrual troubles, seasickness, rheumatism, many more, which we are going to discuss in the next upcoming slides. Moving further to the sphere of action of COCCULUS. Where does COCCULUS act? COCCULUS will act on the cerebrospinal system and produces great debility. So what does COCCULUS do? Acting on the cerebrospinal system, it produces debility in the person. It also causes the paralytic weakness of the spine. Especially, it is acting on the motor nerves, which is resulting in the weakness of the legs. So guys, we see acting on the cerebrospinal system. What does it do? Yeah, acting on the cerebrospinal system, especially it will act on the motor nerves. Okay, motor nerves. Rather than the sensory, it will work on the motor. So obviously, if there was sensory, it could be tingling, numbness and all those. Now here we have to think of the motor nerves. Motor nerves, what would they do? If there is some impairment in this, they will result in the weakness of the limbs, the paralysis. Then we have loss of function, okay, loss of movement. So such are the conditions when the motor nerves gets affected. So here, when there is a paralytic weakness of the spine, okay, it is causing the paralytic weakness of the spine. So from the spine originating the motor nerves, it is resulting in the weakness of the legs. Because of the damage to the motor nerves, there is weakness which is felt in the legs. Okay. The knees give out anytime. What happened to the knees? They feel like giving out anytime. The soles of the feet feel as if they are asleep. Okay, the soles of the feet will feel as if they are asleep. No sensation, no like movement at all. Convulsions, both clonic and tonic, are a special characteristic of this action. So we see it also produces convulsions. Convulsions are both clonic convulsions as well as tonic convulsions. It produces vomiting of cerebral origin rather than the gastric origin. So we see vomiting in cases of COCCULUS. Vomiting, it is rather than the GI vomiting, it is more because of a cerebral origin, which means it could result after head trauma or cerebral origin. It could be because of the meningitis. So any problem in the this is just an example. Okay, the main causative factor for the vomiting rather than the gastric, it is cerebral origin. So let us summarize what we studied with just the picture. What happens in the sphere of action, how does cocculus act? Cocculus will act on the cerebrospinal system. So we see it acts on the cerebrospinal system. Acting on the spinal nerves, what does it do? Spinal nerves, especially the motor nerves of the spine, what does it do? It produces a paralytic weakness, especially the weakness of the legs. Okay, let us just go down now. Acting on the spine, what did it do? It produced the paralytic weakness. It produced the weakness of the legs. The knees will give out anytime. The soles of the feet will feel as if they are asleep, and soles will feel as if they are asleep. And then we studied about the convulsions. How are the convulsions? They are tonic, they are clonic, both. Okay, tonic as well as clonic, both tonic and clonic convulsions are seen. Along with it, there is vomiting. After convulsions, we also think of vomiting, which is cerebrospinal origin rather than the GI origin. It is a cerebral origin. Clear, guys? This is the main pathogenesis of cocculus. So we should have the sphere of action and the pathogenesis on the mind, always about a drug. So once we start cocculus, the moment the word cocculus comes, you need to think where cocculus acts on the body. Now, where does cocculus act? It acts on the cerebrospinal system. What does cocculus produce? It will produce paralytic weakness, it will produce convulsions, rather than the gastric vomiting, it will produce the cerebral vomiting. So this is what you need to remember: paralytic weakness, debility, motor nerves will be affected, it will produce convulsions. Okay, it acts on the cerebrospinal system, voluntary muscular system, and also the sensorium. Okay, moving further to the constitution. So now we know cocculus, common name Cocculus indicus. It is proved by Hahnemann, Menispermaceae family, where it acts, what it produces. Now let's move further to the constitution. What is the makeup of the patient? Physical makeup is, it is especially adapted to the women and the children. So you can see this women, it is adapted to women and children, and this woman who is very interesting. Okay, the physical makeup of cocculus is these women having the light hair and eyes and who suffer during menstruation, pregnancy. Okay, they suffer severely during the curing of menstruation and the pregnancy. Unmarried and childless women, you can see this women suffers during pregnancy, during childhood, and during the menstruation. And what happens is they are adopted to be bookworms. What is she holding in her hand? A book. She is adapted. So let us think she's come on a vacation and there she's carrying a book. So they are always bookworms. They prefer to keep reading. Very sensitive romantic girls. Okay, they keep reading those novels and very girlish behavior, all into the books, very romantic type of girls with irregular menstruation. They have irregular menses. And onanist, is they'll self-indulgence could be there, or excessive sexual indulgence. And also we can think of women who don't need a man, they are self-satisfactory. And person debilitated by sexual excess. So we see the person, because of the sexual excess, is debilitated. So this was the constitution of the cocculus. So what did we study, guys? The cocculus, it is suited to light-haired people and the light-haired and light eyes. They are suffering during menstruation. You can see in the slide what have we written. Women, children, light hair and eyes, they suffer. They suffer when they suffer during menstruation, they suffer during pregnancy. They are unmarried and childless women. She is unmarried and childless. It is adapted to girls who are bookworms, romantic girls who have irregular menses, onanist, person who is debilitated by sexual excess. Temperament, mind is very sluggish. They have a sluggish temperament. Nervous persons. Thermally, as a whole, it is aggravated from the sun. So we see it's a hot patient. Sora is in the background. Okay, they have sora in the background. Miasm is sora. Okay. So let us start with the guiding symptoms. What are the key points which are guiding us towards the remedy? They are vertigo. Vertigo, nausea, vomiting is from riding in a carriage. The person has vertigo, nausea, vomiting. The vertigo followed by the nausea and vomiting, it is because of riding in a carriage or a boat or railroad car, or even looking at a boat in the motion. Even if you're standing and looking at a far boat which is in a motion, you feel nauseous, you have vertigo, nausea and vomiting. Seasickness, car sickness are the grand keynotes of COCCULUS. So one of the greatest remedy in cases of curing this car sickness, sea sickness is COCCULUS. Okay, the nausea, vomiting, vertigo. When just looking at a boat or traveling in a boat or a car or a carriage, then we can think of COCCULUS. Clear? Yeah. There is a great lassitude of the whole system. The whole system has a great lassitude. It requires a lot of exertion. Just to stand firmly, she has to exert herself. Feels too weak to talk loudly. Even the talking, she needs to, put in a lot of effort. She's very weak to even talk loudly to a patient. Okay, the patient is so loudly that he can't even afford to talk very loudly. He's so weak, okay, so debilitated, requires exertion to stand and cannot speak loudly. The other remedy where they are too weak to even talk loudly is Stanamet. Moving further, there is a sensation of weakness or hollowness in the various organs, like in the head, chest, and abdomen. The various organs, they feel the weakness as well as the hollowness, the emptiness will be felt. The stomach feels empty, and then they have this abdomen which feels completely empty. The hollowness can be felt in the various organs, okay, like in the head, chest, and abdomen. They can feel the weakness and hollowness. Clear? What did we see? That there is a lassitude, that the patient can she has to exert herself to stand up, and she cannot speak very loudly. Then we saw the great hollowness. The hollowness is felt in the chest, in the abdomen, and we also saw that the whole body, the various organs like the head, chest and abdomen, they'll have the weakness as well as the hollowness. Okay. The time passes too quickly. Okay, for the COCCULUS patient, the time passes too quickly. Whereas in urgentum nitricum, alumina, medorinum, it is reversed. The time passes too slow for them. You know that urgentum nitricum, the patients are very hurried and worried and very fast. They want things to be very fast. Hurried patients, very much hurriness is seen in them. So for them, the time passes too slowly. In such a hurry they are, that they feel the time is passing very slowly. Here in COCCULUS, time passes too quickly for them. The trembling of the arms and the legs is usually from the excitement. So usually from the excitement, they have the trembling which is felt in the arms and in the legs. The many symptoms are aggravating during her menstrual period, like the piles, and during menses there is debility, nervousness and anger. When we studied the sphere of action, we saw that when we study the physical makeup, we saw that these COCCULUS patients will suffer severely. Okay, they will suffer severely during menstruation and pregnancy. So all the complaints will be aggravating during pregnancy, just like during pregnancy and menstruation, like the piles, and during menstrual period the piles increases, they get aggravated, and during menses there is debility, nervousness and anger. Leukorrhea is seen in places of menses. Naxmoscheta. Other remedies, Naxmoscheta. You can see the leukorrhea in the place of menses. the other remedy where they have leukorrhea instead in the place of the menses. So now you just think the time of the month, like if she had to get her periods, instead of getting her menses, she's coming up with leukorrhea. She says, doctor, I have leukorrhea every month. Instead of the menses, from past 3 months I'm having leukorrhea. Instead of the menses, now it has been replaced by leukorrhea. Then COCCULUS is a indicative remedy if all the other symptomatologies match. When the fever assumes a slow sneaking nervous form, okay, the fever is slow sneaking and a very nervous form of fever with vertigo, disposition to anger, then COCCULUS is thought of. Okay, when there is vertigo and the person is disposed to get angry, then we have to think of COCCULUS. Aggravation from motion, generally even the least jar of motion is unbearable. They have aggravation from the motion, even the least jar cannot be bared. They have aggravation from the motion, even the least jar will be unbearable to the patient. Clear, guys? What did we see? The new guiding symptoms. Leukorrhea is seen instead of menses. The fever is of a nervous order. It is slow, sneaking, nervous order. Okay, again the fever is of a nervous order. Just like the vomiting was of the cerebral origin, fever is of a nervous order. There is vertigo, disposition to get angry. COCCULUS should be thought of. Fever, vertigo, anger. Okay, vertigo. They have fever which is of a nervous origin. Okay, fever of a nervous origin associated with vertigo, and the person is disposed to get angry, then COCCULUS should be thought of. Aggravation from motion, generally even the least jar is unbearable to the patient. Mind, the time passes too quickly to the patient. The patient cannot realize that a whole night has passed, a week has gone, but still for the patient it might seem just as a moment has passed by. The patient cannot bear contradiction. You can see in the picture here the time. With this picture you can remember in COCCULUS. Remember COCCULUS. Okay, COCCULUS, we see the time passes too quickly. Okay, the time passes too quickly for them. And the other mentals, they cannot bear contradiction. Contradiction they can't bear. Contradiction is unbearable to the patient. You cannot speak something which is contradictory to them. Now if they say something and if you speak the opposite of it, they'll not be able to bear it. What they say have to be done. Okay, they cannot bear any sort of contradiction, even in the action, speech or whatever. So the contradiction is highly unbearable. They get offended. Even the trifle matter makes him angry. A silly trifle matter will make the patient very angry. A small silly matter, you just said something which was not even offensive, but the patient gets angry and he's easily offended and he cannot bear that contradiction. There is slowness of comprehension. So the patient's understanding will be very slow. He's not very we saw even in the temperament that the patient is having a very sluggish temperament. The mind is very slow. Slowness is seen in COCCULUS. Okay, they're not very fast and rapid. So we see the slowness. The slowness is seen even at the mental level. So the comprehension in the patient is very less, very slow. Okay, you can see the picture here. The comprehension is very difficult for the patient. Slowness is seen. They cannot find the right word to express his thought. So slow does his mind work. Now if the patient wants to express something, he wants to tell you the complaints what he's facing or what is going on with him, but there is such a marked slowness that the patient can't even express himself. He can't find the right words. Such a slow the mind works. Okay, the patient can't find the right words to express the thoughts. So slowly does his mind work. What has passed, he cannot remember. Okay, what has passed, whatever has just passed, he cannot remember it. There is weakness of memory. He forgets what he had just read. So now we are studying about COCCULUS. We can retain in our memories what the COCCULUS does, where does it act, what it produces. So now we read about COCCULUS. So how far can we recall it? Yes, COCCULUS acts on the cerebrospinal system. It produces paralytic weakness. It produces debility, convulsions, tonic, clonic, weakness of the legs, vomiting, which is of a cerebral origin. So very well we are able to recall the pathogenesis. And now here the COCCULUS patient, if it is a COCCULUS patient, it can barely tell you COCCULUS. What did we study? COCCULUS. And under where does it act? Very slowly. He can't even remember what he just studied. Okay, forgets what he just read. What has passed, he cannot remember. There is lassitude. That lassitude is seen in the whole mind. Okay, the patient feels lassitude in the whole mind, feels too weak. All the mental symptoms are because of grief, anxiety, frustration, vexation, prolonged loss of sleep. Very important. When the patient has a prolonged loss of sleep, and then you see, we know, okay, generally when we are completely sleep deprived, okay, sleep deprived, so you had been out, and then you were out of your town, and then you came back late in the morning, and then you had to go to your college or the university, and then the day will be very slow. There'll be slowness in your movement, slowness in your speech. You're sleep deprived just for one day. If it is producing such effects, just imagine the COCCULUS patient is having the loss of sleep which is of a prolonged period. So the slowness have been set in his mind, the forgetfulness, slowness. And when the patient is like this, and the ailment from, he comes up with loss of sleep, especially the prolonged loss of sleep, and the night watching, anger, grief, vexation, the mental excitement. These are the ailments, okay, which are producing the mental symptoms. Clear, guys? Are you sure of the mentals? Should you just do a quick revision? Here, the pictures will do, okay? What happens in COCCULUS? The time passes too fast, okay? The time is passing too fast for the patient. The whole night passes, the whole week passes. He just cannot, get a catch of the time. He feels the time has passed within a moment. Then contradiction. We studied about contradiction. The patient cannot bear contradiction. Slightest word will offend them. It will make them very angry. And then the slowness. Then we studied about the slowness. The slowness is seen in the level of comprehension, to express their thoughts. In expression, comprehension, the level of slowness is seen. And the patient cannot remember what he just read. The lassitude, the weakness, and that debility will be seen in the whole mind. The patient feels weak, okay? And we saw the ailments, that is the grief, vexation, and we have anxiety and the prolonged loss of sleep. Now let us move on to the general. What are the ailments from in COCCULUS? We have the loss of sleep, night watching, anger, grief, vexation, and mental excitement. You can see night watching, loss of sleep, and anger, vexation, and mental excitement. Clear? Let us move on to the particulars. So, having the guiding symptoms and the pathogenesis on the mind, let us see what are the particular indications of COCCULUS. So, people find the particulars difficult, especially the students. As students, we find the particulars difficult. So, let us have on our mind what is the pathogenesis that needs to be clear in our mind. Where does COCCULUS act? Having that on the mind, let us start with the particulars. Headache. The patient has a very severe sick headache. The headache is very severe headache, okay? The patient has a very severe sick headache. What could be the causation for the headache? It could be, now we studied the ailments from, so we can list it, okay? What are the causes? It could be the loss of sleep, or the night watching, headache because of the loss of sleep, night watching, and mental excitement, grief, vexation, anxiety. Moving further, when is the headache seen in COCCULUS? It is at the menstrual period. We saw all the complaints. The patient suffers severely during menses. is what we studied under the constitution. So when we were studying the constitution, we saw that these women will severely suffer during menstruation, and we also studied the guiding symptoms, that the complaints are aggravated during menses, especially the piles. So again, you can think of headache here. It is also aggravated, or it is appearing during the menstrual period, headache during menses. Location: headache is starting at the nape of the neck and occiput, and it is extending to the spine. Very beautifully given in the picture. It is starting at the nape of the neck and it is extending into the spinal cord. Okay, it is extending into the spine. Starting at the nape of the neck and extending to the spine. You can see in the picture here, the nape of the neck extending to the spine. Clear? So let us just summarize the headache, and then there are other symptoms as well as the character modalities. Next slide we'll discuss. Here now, what did we study under headache? Headache will be very severe. It will be a sick headache, very severe headache. What is the cause for the headache? The loss of sleep, the mental excitement, grief, vexation, anger. Then we studied when does this headache occur? At the time of menses. What is the location of the headache? It starts at the nape of the neck and extending to the spine. Clear, guys? Moving further. What is the sensation? The patient feels emptiness in the head. When we studied the guiding symptoms, we saw that there is a sensation of weakness in the various organs. There is a sensation of hollowness in the various organs. So they saw the weakness and hollowness in the various organs in the COCCULUS patients. So here in the head, they have the emptiness or the hollowness. Opening and shutting sensation especially is felt in the occiput. So here in the occiput, they have this opening and shutting sensation. They feel opening, shutting, opening, shutting sensation. So the opening and shutting sensation is seen at the occiput. That is the sensation of weakness, sensation of emptiness, hollowness, opening and shutting sensation in the occiput. What is the character of pain? As if it is tightly bound by a cord. There is a sensation as if it is tightly, the pain is they have a sensation as if they are tightly bound by a cord. There is pressing, throbbing type of pain. What is the type of pain? Pressing and throbbing type of pain, and it is aggravated when the patient is lying on the back and also from the carriage riding. Okay, when the patient is lying on the back and from the carriage riding, they have aggravation from carriage riding, and also if the patient is lying on the back. Okay, fine. So I hope the headache is clear. Now in this slide we saw the sensation as if they are tightly bound, and there is a sensation as if the occiput is opening and shutting. Okay, and the character of pain, they have also in the sensation we saw the emptiness. Character of pain, pressing, throbbing type of pain. Okay, and tightly bound by a cord. We saw this already. So aggravation when the patient is lying on the back. There is aggravation of the headache when the patient is lying on the back. The nape of the neck, occiput touching the bed. So the slightest jar is also resulting in the pain, right? So here you can see just the touching or the slightest jar of the occiput head. When the patient is lying on the back, what happens? The complaints are aggravated, and also riding in a carriage, there is aggravation. Moving further to the vertigo. Now headache is done. Now we are going further to the vertigo in cases of COCCULUS. So vertigo, there is a sensation as if intoxicated with the pain. Okay, there is a sensation as if they are intoxicated, and they have pain in eyes when they are rising in the bed. Okay, when the patient rises in the bed, he has pain. Okay, the patient rises in the bed, he feels pain in the eyes. Vertigo with the pain in the eyes. Vertigo, the patient feels as if he has intoxicated. Let us think of a bottle here. Yeah, the patient feels as if he has intoxicated, and there is vertigo with the pain in the eyes when the patient is rising from the bed, from the motion of the carriage. Especially when they are rising or sitting up, they have pain. Especially when the patient is rising and sitting up, there is vertigo. Okay, Sorry, there's not pain, there's vertigo. We're discussing about vertigo. Clear, guys, about the vertigo? The patient feels as if intoxicated, with the pain in the eyes when the patient is rising up in the bed, especially sitting up, or by the motion of the carriage, they have vertigo. Moving further to the abdomen. So let us see the GIT. Okay, the abdominal complaints of COCCULUS. There is a sensation of abdomen of cutting and rubbing. On every moment, the patient feels as if some sharp stone. Okay, there is cutting, there is rubbing. At every moment, he feels there's a sharp stone, and that rubbing and cutting sensation is seen in the abdomen. Okay, imagine a sharp stone and the rubbing and cutting sensation. Okay, let us imagine a sharp stone and the rubbing and cutting sensation. The rubbing and cutting sensation as of a sharp stone in the abdomen. And we also know there will be hollowness, emptiness in the abdomen, crampy pain in the stomach during and after a meal. They feel this crampy pain in the stomach. Okay, they feel a crampy pain in the stomach during and after meals. There is loss of appetite and a metallic taste in the mouth. In the mercury group also we saw that they have a metallic taste in the mouth. The Merck salt, Merck cord, they have this metallic taste in the mouth. And nausea and vomiting is from riding in a carriage, boat, railroad, car, or even looking at a boat in motion. So when we studied the guiding symptoms, we saw that they have nausea, vomiting when the patient is riding in a carriage or boat, or just even looking at the boat which is in motion, rail, road, and car. Moving further to the female genital organs, should we just summarize it? The abdomen. Abdomen, what did we see? There's a cutting and rubbing pain as if by the sharp stone, hollowness, and we saw the crampy pain in the stomach during and after meal when the patient is having the food, or after he finishes the meal, he has a crampy pain in the stomach. The crampy pain is felt during and after the meal. Loss of appetite, metallic taste in the mouth. And about the nausea, vertigo we saw. Moving further to the female genital organs. COCCULUS is an excellent remedy in menses, especially the dysmenorrhea, very painful menses, which is, restricting the day-to-day activities of the women. Then we have to think of COCCULUS, which is an excellent remedy for dysmenorrhea, painful menses. The time of the menses, it appears a little too early. Okay, if it was supposed to come on 25th, it is coming on 16, 17. So it is coming a little too early. What is the character of menses? Dark and clotted blood. They have this menses which is dark, and they have the passage of the clotted blood. The clots are passed. Okay, what is the character of menses? There is dysmenorrhea. It is appearing too early. Dark and clotted blood is passed. The character of pain during menses. During the flow, there is spasmodic colic. You can see here. Okay. During the flow, there is spasmodic colic, pressing pain in the uterus, followed by the hemorrhoids. We saw during menses, the piles appear during menses and they get aggravated. So during the flow, there is colic, pressing pain in the uterine region, followed by the hemorrhoids. During menstruation, the patient is so weak that she is scarcely able to stand. We saw that they have to exert a lot to just stand up. And they have weakness of the lower limbs. Concomitants, piles during menses. Okay, let us star that point. The piles during menses, we have to think of. Okay. The piles during menses, then COCCULUS. Okay, piles during menses, COCCULUS. Clear, guys? It is used in dysmenorrhea, too early, too profuse menses, dark and clotted blood. And what is the character of pain? There is spasmodic colic, pressing pain in uterine region. Okay, spasmodic colic. There is spasmodic colic. And a pressing pain. The pressing pain is felt in the uterine region. And there is hemorrhoids, followed by hemorrhoids. And the patient is so weak that she is scarcely able to stand. Weakness is felt in the lower limbs. And the piles during menses is a good concomitant you can remember, will help you in your prescription. COCCULUS is the remedy which is indicated for piles during menses. Moving further to the leukorrhea, in the place of menses or between the periods. So when we studied the guiding symptoms, we saw that leukorrhea in the place of menses. Which was the other remedy we saw? Leukorrhea in the place of menses. You can put it down in the comment section if you remember. I will tell you the answer. It is nux moschata. Okay, the leukorrhea in the place of menses, we have COCCULUS, and the other remedy we just saw, one of the remedy we saw was nux moschata. So the leukorrhea in the place of menses or between the periods, they have leukorrhea. There is a copious discharge, there is a copious discharge of the leukorrhea like the washing of the meat. Serous, ichorous and bloody discharge. There is a washing of the meat, serous, ichorous and a bloody discharge is seen. Paralysis of the face. So let's move on to the paralysis. The paralysis of the face, paralysis of the limbs, and we can see paralysis of the muscles anywhere. In case of COCCULUS, it will act as an excellent remedy, okay, for the paralysis resulting from the weakness or there's a damage of the motor nerves of the spinal cord, then which is resulting in the paralysis, we have to think of COCCULUS. Okay, COCCULUS, which is causing the paralysis of the face, limbs or anywhere there is paralysis, it is a very good remedy. There is trembling of arms and leg from excitement. We saw that in the guiding symptoms, the trembling is seen of the arms, the trembling of the legs from the nervous excitement. The pain in the limbs, the lower limbs especially, will feel very weak with pain and they're very much painful especially when they are flexed. Okay, they feel pain when they are flexed, and it is worst after sleep. The pain is worst after the patient sleep. So this was all about the paralysis, and a quick modalities we will see. Okay, the general modalities. So what are the modalities? Aggravation and amelioration. Okay, let me just write it somewhere here. Yeah, the aggravation and the amelioration in cases of COCCULUS. Can we guess some? Aggravation could be carriage riding. We saw that carriage riding could be an aggravation. Slightest motion, rising up in the bed during menses. Okay, rising during menses when they rise. And then okay, we also have the others like talking, sleeping, aggravation, the worst from sleeping. The paralysis is worse from sleeping. Also the eating, drinking, smoking, talking will aggravate the complaints. Okay, so this is all about the COCCULUS indicus. I hope it is clear, and if you like the video, hit the like button and subscribe.